My name is Jim Hruby. I'm the Director of IT at Parkview. I've been working for Parkview for about 5 years. Parkview is a community-owned hospital in Pueblo, Colorado. We have 350 beds. We're one of the last 2 community-owned hospitals in the state of Colorado, us and Boulder Community Hospital. So we're not tied to any other hospitals. We're kind of out on our own. The one thing that does afford us is the ability to send patients wherever they can get the best care. The relationship that we have with Summit, I was trying to think of the best word that would describe that, and I think it would be family. Every time I see Summit or every time I talk to Summit on the phone, I feel like a closeness, and they treat at least us, and I would imagine all their customers, as family members. We started with Summit because we went to Meditech 6.0, and Meditech 6.0 required an engine to manage all the orders and all the system responses that you need to do and interfaces that you run within Meditech 6.0. So we have a local exchange, a Colorado health exchange called Creo. And we went to them and said, can you be a HISP? And they said, when do you need to have it done by? And we said, well, we have to be ready by July. And so they had about 3 months, 90 days to get it done. And they said no, or actually, after they stopped laughing, they told us no, that they could not do it. So we called Summit, and Summit was there for us. And I think the attitude that Summit always gives us is that it's a can-do attitude. We're going to figure it out. Whatever it takes, we'll get you up and running. It's no problem at all. And so we purchased the Care Exchange module, which allowed us to use that HIS portion, but it gave us much, much more. So we send all of our CCD, we do all of our data share, we do everything through the Care Exchange. And it's really provided us a solution, a tool that we're going to continue to use and carry on as we grow with Summit. The implementation timeline was 3 months. And I don't care who you are or what you're doing, that is very quick. Now, we were blessed because we had Boulder, who was actually 3 months ahead of us in this timeline. And Boulder Community was very helpful in making sure that we chose Summit, that we were moving down the right path. They had kind of gone through the same stuff that we had 3 months in advance. So it was really nice to be able to use them to bounce stuff off of, and we were able to go live and meet all of our go live and meet meaningful use, because you had to be able to have that portal up and running with view, download, transmit at that point in time before the attestation period, which was July 1st. So we had to get everything up and running, and I think it was like 2 days before July 1st, we were completely up and running with all the tools that we needed to be successful. Having the Care Exchange at this point in time, we're trying to find other opportunities to use it. One of the big things is we have 150 doctors in our ambulatory side, so they're hospital-owned physicians. And with those physicians, we need to be able to share information. That's one of our biggest things. So currently we're working on, we already send the CCD out to them, and so they get all the information from the hospital stay through the Care Exchange platform. We will continue to do business long-term with Summit, and I'm really excited about a couple of the products that we're going to purchase this year. We're looking at the alert that you have, which will allow our doctors to receive alerts directly from the hospital when their patients are seen at the ED or at the hospital, and then be able to go into a portal and actually look at all the information from the stay, as well as customize the information that they see. The biggest problem that we have with doctors is they don't want to see the full CCD. Sometimes the CCD is 50 pages long. They want a quick synopsis of what happened and what they need to talk to their patient about. And so I'm really excited about that system. So if we get that portal set up, we can make a lot of doctors very happy. We'll be with Summit forever. So we'll be a long-term customer, that's for sure.